everybody. Good evening. My name is Charlene Margot, and I'm the founder of the Parent Education Series and co-founder of the nonprofit, The Parent Venture. We are fortunate to be one of the organizations funded through Sequoia Healthcare District's Healthy School Initiative. So it is a real honor and a pleasure to be here with you tonight, especially for February's Heart Health Month. This event tonight, the town hall, is inspired by the CEO, Pamela Kurtzman, who is committed to doing monthly town hall meetings with you, the community, this year, especially during COVID. And we couldn't think of anything more timely than heart health. So tonight, we are very fortunate to have with us some real community experts from the healthcare organizations and even a physician, board members. So we're very happy tonight. We're going to tell you more about our panelists in just a minute. Before we get started, format-wise, we're going to start by having Pamela Kurtzman, again, the Chief Executive Officer of Sequoia Healthcare District, tell you a little bit more about the district and the work that it's doing during COVID. And then we will introduce our panelists. They will each tell you about their work and what they've been doing around heart health. And then we really want to hear from you, our attendees, community members, healthcare professionals. So there is at the bottom of your screen, before I get started any farther, if you need Spanish interpretation tonight, we have simultaneous Spanish available with Cynthia Hinestrosa. At the bottom of your screen, you'll see a globe. If you click on the globe and then Spanish, you will hear information in Spanish, everything that we're saying in Spanish. So again, thank you, Cynthia, for that tonight. So format-wise, if you have questions, and we hope that you do, please type them into the chat button. In the chat, you'll also be seeing links about relevant organizations, things from the Sequoia Healthcare District. If you want to talk to one another or talk to us, the panelists, please do that in chat as well as your questions, okay? So we look forward to hearing from you tonight. We really want this to be an authentic town hall where you are all free to engage and ask questions of the panelists or Pamela, anybody here tonight. All right, I think that is about it for our organizational information. I'm going to turn it over to Pamela Kurtzman now, the CEO. Take it away, Pamela.
Thank you, Charlene. It is fantastic to see you all here tonight. I think we've been so focused on the pandemic and all of the outcomes and effects of that. We haven't, I think, given a lot of thought to our own well-being sometimes, and particularly probably not our hearts. But as Charlene alluded to, we have a monthly town hall, and this is the perfect month, being Heart Health Month, to host a heart health presentation. And I have an expert panelist here, and I can't wait for you to hear from them. But I always think about my heart health. I'm fortunate to have, as far as I know, a healthy heart physiologically, but I also keep my heart healthy by thinking about gratitude and thinking about things I'm hopeful for and thinking about things that that even in the midst of the most challenging times, probably of our lifetime, we really have so much to be hopeful for. And so I'm grateful to you guys tonight for being here, and I'm hopeful that that we all get through this, and that we all get through this COVID-free and with healthy hearts. And so I'm just going to give you a quick background of the district for those who don't know about the district. I'm going to be super high level and super brief because we really want time with our panelists tonight. The district has been around since 1946. We're one of 79 healthcare districts in the country. And we're sort of a hybrid district. We no longer own our hospital. We have a strong partnership with Sequoia Hospital though, but we now just run and our own programs, but as well as we provide grants to about 80 different nonprofits in the community. And one of those programs was started in 2006, and that's our HeartSafe program. I started that with placement of AEDs and CPR instruction, specifically in our schools that moved to the parks and all of our public places. We now have about 350 AEDs in the community. That was our very first program. We have a Healthy Schools Initiative, $4.5 million annual grant that we support persons like school psychologists, PE instructors. We support a number, about 68 different positions within 8 different school districts. That supports about 30,000 students in our district. And our district runs from Belmont, San Carlos, Atherton, Portola Valley, Redwood City, So we have the North Fair Oaks community, Portola Valley, and Woodside. And I think I got them. There's 7 of them. So we have about 230,000 residents. Our annual budget is around 16 million a year, and the district is committed to putting 100% of those dollars out into the community. More specifically, in COVID, we've so far distributed about $3 million in COVID funds. Part of that goes to our $4 million community grants program, and the other $2 million has gone out to support our local nonprofits. So without further ado, I do want to introduce you to our panelists so they have plenty of time to tell you about heart health, which is why you're here. I'm going to start with my board, our former board president. She has been our president the last couple of years, Kim Griffin. It's been wonderful to work with her. She is now still on our healthcare district board, I think going on 9 years. Kim, you can correct me if I'm wrong on that. And she's a registered nurse at Children's Cardiology in the Bay Area. I'm super excited to have her talk with us tonight. And then Michael Griffin, her husband, a board certified physician in general pediatrics, pediatric cardiology, and adult congenital heart disease. Dr. Griffith practices at Children's Cardiology of the Bay Area. And we have Liz Lazar-Johnson. She's the founder and executive director of Via Heart Project. And the Via Heart Project is a nonprofit organization. They're dedicated to the awareness, education, treatment, and prevention of sudden cardiac arrest. And they've been our longtime partner. They manage all those 350 AEDs that we have out in the community. Make sure that they're up to working condition and that people are trained and know how to use those. And then we have Erica Lyons. She is our CPR instructor extraordinaire. She's been teaching infant and adult CPR classes for us for the last couple of years. She's even doing them virtually. We're the only virtual CPR program in the county that we know of. So before they get going, I'm going to hand it over to Charlene, and she is going to kick off the discussion. So thank you.
Well, thank you, Pamela, so much for that introduction and great introduction to the healthcare district and our panelists tonight. We could not be more excited or grateful to the panelists that we have with us tonight. And I think everybody is online is interested in heart health, and you're going to learn a lot. Okay, so Kim and Michael and Liz and Erica, I'd like to start out by giving each of you a few minutes to tell us about yourself and what brought you to the arena of heart health, and what you're seeing in the community or the patients or the students or the children that you work with. Kim, let's kick it off with you.
So good evening, and thank you everyone for joining us. Currently, I am a registered nurse in an outpatient pediatric cardiology practice that also sees adults with congenital heart disease. But tonight, I decided to focus on heart health and safety for adults, just because during the pandemic, we have seen a lot of people defer medical care, not go to the doctor, and often for very serious symptoms. So that's why I want to focus on how to recognize an impending cardiac emergency and know what your risks are. Can you hear me, Charlene?
I can hear you.
Okay.
Are you sharing slides for Kim?
Are we starting now with slides, or did you want to do go around and have everybody introduce themselves?
Either way, we can go ahead and have people introduce themselves, and then we'll come back, Kim, and do the slides. How about that?
Okay, I was just a little confused.
That's okay. Let's keep going then. Michael, Dr. Griffin, why don't you tell us a little bit about yourself?
Hi, I'm a pediatric cardiologist. I practice in San Mateo. I also see patients with adult congenital heart disease. And, I think, I really spend a lot of time trying to, because of my orientation more towards children and young adults, we're really trying to identify problems early and keep them from becoming big problems as patients progress on to adulthood. Okay,
thank you very much for that. We look forward to hearing more from you. Let's see. Liz, why don't you tell us a little bit about yourself?
My name's Liz Lazar-Johnson. I'm the executive director of Via Heart Project, and we're a nonprofit that I started back in 2010, based in San Francisco. I've been working with AEDs and sudden cardiac arrest awareness since 2003. And my nonprofit has been working with Sequoia Healthcare District since the beginning. I believe I started consulting before I even started the nonprofit back in 2006 with Sequoia Healthcare District. And yeah, we're committed to reducing the rate of death from cardiac arrest in our communities here in the Bay Area. And I'm really excited to share some information about that with you guys tonight.
Great, thank you so much, Liz. Erica, last but definitely not least, tell us a little bit about yourself and the work that you do.
Hi, everybody. I'm Erica Lyons. I am the CPR instructor for adult, child, and infant CPR classes that we hold here in our building. However, right now we are doing it virtually. So I am not really in touch with the public at the moment. I'm online with them, but one of the things I'm the most proud of is being able to do this class online at Pamela's suggestion and just bring heart health awareness to the community at large. And I can't wait to get out there and teach when this is all over and behind us.
Thank you so much, Erica. All right, Kim, let's go back to you to learn a little bit more about heart health with regard to adults, signs to look for.
Okay, and so we can start my slides. I'm just going to dive right into this. Jenny, I think Jenny's going to start. Yes, thank you, Jenny. Okay, so yes, that's me, and we can just progress to the next slide. So this is what I want you to know and what I will review tonight. And know my numbers, know my history, know when to screen, know when to go to the emergency room, and know when to go home from the emergency room. Next slide. Know your numbers. So you want to know your blood pressure. And so ideally a blood pressure of no more than 120/80 or lower. And stay tuned because they are looking very closely at blood pressure, normal blood pressure for women. And there is some consensus that that top number really needs to be lower for women, more like around 110. So we don't have a total consensus on that yet with the American Heart Association, but my guess is that there will be a lot more people that end up on blood pressure medicine once that's adjusted for women. Know your cholesterol, know your waist circumference or measurement, no more than 35 inches for women and no more than 40 inches for men. So if you're out of the norm for any of those numbers, that does put you at more risk for heart disease. Next slide. Know your history. What's your family history? Do you have a history of cardiac arrest or heart attacks in your immediate family? Do you smoke or have you smoked, or do you live around someone that smokes? Are you diabetic? Do you have a history of high blood pressure? And what is your ethnicity? So those African Americans, Native American Alaskans, Native Americans, Latinx, South Asian, and Pacific Islanders are all ethnicities that have a higher risk for cardiovascular disease. Know when to screen. You're going to screen cholesterol starting at age 8, after puberty, at age 20, and ideally every 2 years, and probably more frequently once you know that your cholesterol is elevated beyond normal. Blood pressure should be measured yearly, even in the pediatric population. And at age 50, you should have a screening EKG and a stress echocardiogram. Now, I give age 50, but if you are in any of the risk categories that we just reviewed, you're going to start that screening a lot sooner. Next screen. know when to go to the emergency room. You're going to go for chest pain, lightheadedness, nausea and vomiting, jaw, neck, or back pain, pain in your shoulder or arm, shortness of breath. Are you feeling sweaty or clammy? Do you have a feeling of anxiety or a feeling of impending doom? Heartburn or fatigue? And I'm just going to talk a little bit about heartburn because I think a lot of people mistake chest pain for heartburn or vice versa. So you have to be very, very careful with that. And a lot of people just have chronic heartburn and they know what alleviates that. But if it's really something that's out of the usual for you, then you need to be a little bit more suspicious. And also fatigue. And I think a lot of us can say, well, we have a lot of fatigue because we're working hard. But I think fatigue outside of the normal, where you just really don't have the get up and go that you normally would. And that often can be the only symptom behind a cardiovascular problem. Chest pain and some of these other things can be, they're very subjective. But I think that you have to really know yourself and know what is really out of the norm for you for a lot of these symptoms. Next slide. And if you suspect that you're having some kind of cardiac event, we recommend that you take an aspirin. And the reason that we do this is that we want your blood to be a little bit more on the thin side. Because if you have a clogged artery, we don't want you to finish clogging that artery up with the clot. So Jenny, if you can flash back the screen to me, I've got a model. So I hope you can see this. So this is a picture of an artery that has started to stenose off because of plaque. And what often happens when you're having a heart attack, you can throw some clots and they get stuck down in these crevices where the plaque has really thickened. And that's what really causes a severe heart attack a lot of the time. So an aspirin can help, and you're really not going to hurt yourself by just taking one aspirin. So those are some of the symptoms that are going to bring you to the emergency room. And my last slide is know when to go home from the emergency room. So next slide, Jenny. Your electrocardiogram should be normal. We measure something called cardiac troponin levels. Those should be normal too. Higher than normal troponin levels can indicate a cardiac event. Your pain should be totally subsided, I believe. And then of course you're going to follow up with a primary care physician. And a note of caution, don't always assume that your primary care doctor is going to know when you've showed up at the emergency room. Always call them the next day and try to take your notes and all of your electrocardiograms, any studies, any labs with you to your primary care doctor, and ideally the next day. And a lot of people would probably question this and say, well, why do I need to know when to go home? And in most cases, you're going to have a very competent person that evaluates you and decides whether you need to stay or whether you need to be discharged. But again, be your own best advocate. If you're still not feeling right and you think something's wrong, speak up and be your own best advocate and just say, I'm just really not feeling well enough to go home, or I don't feel comfortable going home. The other thing that I really should have mentioned too in one of my slides, and with symptoms with when to go to the emergency rooms, is there are some symptoms related to stroke that you should know about too that can be related to a cardiac event, but it could just be a stroke as well. And a lot of us know, the symptoms of weakness on one side or the other, or problems speaking or expressing yourself would be another symptom. But often with a stroke, it's just dizziness. So that kind of concludes my presentation, and I'm going to just go ahead and let Charlene move on to the next speaker, which I believe is Dr. Griffin.
Yes, indeed. Dr. Griffin, are there some things that you would like to add in terms of what you see with cardio problems in children and youth? How do those issues present differently?
That's a good question. I think that children oftentimes are much more healthy to begin with. So their organ systems generally, it's pretty easy for them to hide some pretty significant heart problems just because they have all their other organs are very, very healthy. And so as a result, you have to watch them a bit more closely to see or find the symptoms that you want to watch for, such as shortness of breath with exercise, unexplained dizziness or passing out, abnormal heart rhythms, those kinds of things.
What about children who are experiencing a panic attack? Do they end up in the ER thinking that they're having a heart attack?
Almost certainly. It's hard to divorce the heart from the head, especially when it comes to heart problems. So oftentimes some of the same symptoms that, especially now, because there's quite a bit of anxiety, in our school kids and adolescents, that they're having lots of symptoms of chest pain, shortness of breath, tachycardia, particularly at night before they go to bed, that kind of thing. Those can be symptoms of anxiety. You always have to kind of make sure that there's not an organic explanation before,
Uh-oh.
Michael, looks like his screen might have frozen there. Okay, well, hopefully he will reconnect with us in just a minute.
Charlene, while he's frozen, I forgot to say, I wanted to say a few quick things about COVID as well. And the fact that it is a highly inflammatory disease and it can affect the heart in adults as well. So we know COVID in particular attacks the lungs, and when the lungs are severely affected, it's going to affect the heart for sure. So a lot of people that end up in the hospital with COVID end up at least with some heart failure, but it can also attack the pericardium, which is that sac around the heart that can cause an inflammatory process there. And then the heart muscle itself can also get inflamed. So, and then word of caution, we're in uncharted territory with COVID. So even if you had a mild case or, a moderate case that didn't bring you to the hospital, down the line, we could be finding out a lot of things in terms of cardiac effects from COVID.
Well, I've been reading recently about children who passed away unexpectedly from COVID, and they did not have the same signs or symptoms that we expect in adults. So if you're a parent and your child is, what would be some presenting elements of COVID that as a parent we should be looking for, Kim?
Well, you've heard about the multi-system inflammatory process that happens in kids that we've often seen in Kawasaki's disease. So, high fever, a lot of swelling and rashes, and those kids with those symptoms related to COVID rather than Kawasaki's have been pretty severe. Fortunately, not a large percentage of kids, but then we've seen some kids with comorbidities, like we've seen a kid with Down syndrome, we've seen a child with some congenital heart disease, and some kids with diabetes that have really ended up with sort of almost the adult-like COVID symptoms as well. So high fever, shortness of breath, all of those things that really brought older people to the hospital.
Okay, thank you. Do we have Dr. Griffin back online yet? No?
I might have him just sit in my spot.
Okay.
Okay. But we can move on to somebody else while I get him.
All righty. That sounds like a good plan. Liz, I think that parents really and people online are interested in hearing more about heart screening. Can you tell us about what your organization does and why these heart screenings are important?
Oh, sure. So my organization does a couple different things. We manage AED programs for communities, businesses, and school districts. And then we also do heart screening. So we not only manage AED programs to try and treat cardiac arrest, so there's an emergency defibrillator there if somebody has cardiac arrest, but we do heart screenings on children between the ages of 12 and 25 to determine if they have any heart defects that could lead to cardiac arrest. So it's both the treatment and the preventative measures that Via Heart Project is doing now in the Bay Area and Northern California. The instances of cardiac arrest amongst adults are about 350,000 a year deaths from cardiac arrest. And just to put that into perspective, that's 10 times more than breast cancer. That's more than breast cancer, lung cancer, prostate cancer, AIDS, and gunshot wounds combined. So it's one of the leading killers of adults in the United States. One of the things we focus on is children and heart health and finding if they have heart defects to prevent cardiac arrest. About 10,000 children die a year from cardiac arrest. And compared to the adult number, you may think that that's not a lot, 350,000 versus 10,000, but that's like 2 airplanes full of children crashing every day, like 2 747s when you think about it. Like that's a lot of children that if we had an airplane full of children go down 2 a day, that's how much are dying of these heart defects, and they don't know they have them. There's not a lot of signs and symptoms. Sometimes they can be attributed, a child can have the fluttering of the heart, and parents can just knock it up to anxiety or panic attacks and give them Xanax and go along their way, while the children are still playing sports or going along with this heart defect that's really just this sort of a waiting killer, of them. And so one of the things that we encourage parents to do is know the signs and symptoms. So if your child is fainting or having a seizure-like thing during or immediately following exercise, that's a sign and symptom that there may be something wrong with their heart. If they have like an irregular heartbeat or racing heart, that's not necessarily a panic attack. That could be a sign of something wrong with their heart. If you've had family members that have died suddenly from things like drowning or car accidents that are fully unexplained, they could have had cardiac arrest during those activities. You always hear like, oh, Aunt Martha was a really good swimmer. I don't understand why she drowned. It's probably because she had cardiac arrest in the water. And so family history is something you need to look at. These kids are doing diet pills and energy drinks and things like that that can really affect the heart. So those are some of the things as parents, and I'm a parent myself, I want to be aware of with my child to make sure that, I'm just on top of it. And if they come to me or I ask them questions about how they're feeling with the sports that they do, or just during gym class or on a daily basis, and then as a parent, I'm my own best advocate and I'm my child's best advocate, and I'm going to go to their primary care physician and ask for some further testing. And so one of the things that Via Heart Project does is we come into the schools. We started our heart screening program in 2015. And our first heart screening was actually within the Sequoia Healthcare District at Sequoia High School. And since that day in 2015, we've screened almost 6,000 kids in Northern California for heart defects. And we've done this with a 12-lead EKG, a family history review, and an echocardiogram when needed. And we have found about 1 in 100 kids that have a heart issue that they didn't know about. So at some of our screenings, we're screening 400 or 500 kids, and we're finding anywhere between 3 and 7 kids at those screenings that have issues, heart issues that could lead to sudden death before the age of 50. So those are really fascinating numbers to find. And we're hoping that we can, by doing all these heart screenings, that we can get enough data collected that we can start to change the law in California so that the annual physical does include a 12-lead EKG eventually. It's a really simple test. Reviewing it takes a little more effort than maybe some primary care physicians may have. They need to be trained in how to read a youth EKG. But we really are finding a lot of electrical defects in the heart just doing a 12-lead EKG. So someday my goal is to have 12-lead EKG for every kid in California. So we'll see if that happens. I'm working on it.
That sounds great. 1 in 100 is actually seems very significant.
It is. And the nationwide statistics say 1 in 300 have a heart defect that could lead to cardiac arrest. We're finding 1 in 100 that have a heart issue. So 1 in 100 have a heart issue. It may or may not lead to cardiac arrest. And 1 in 300 have one that they need to get fixed right now. You know,
Wow.
and yeah, it's a significant number.
So we're going to come back to that, but Dr. Griffin, I'm sorry, we got interrupted. Do you want to pick up where you left off, telling us about what you're seeing in your patients?
Yeah, so do you want me to go ahead and go through the prepared remarks that I have, or just answer?
No, please do go ahead.
Okay, could I have the first slide, please? Thanks, Jenny. Next slide. So the goal just of a brief presentation today is really to review the causes of cardiovascular disease in children, which I think Liz has actually covered pretty well, and then causes of sudden cardiac arrest in children, just as a review for everybody to get everybody on the same page. And then review a few small of the cardiac concerns regarding COVID-19 in children, and a little bit about return to play recommendations that are current. Next slide. I think the most important thing, you know, as you've mentioned, Charlene, is that this is Heart Month. It's kind of winding up at this point, but it was actually established by a presidential proclamation in 1964 by Lyndon Johnson. And I think it underlines how important cardiovascular disease is. It actually is probably the largest killer of men and women in the United States and worldwide, more than cancer and lung disease combined, period. And so I think the most important statistic is really that in somewhere between 2015 and 2018, somewhere around 127 million Americans had some form of cardiovascular disease. So the disease burden is fairly high. The good news is that the number of people who are dying of heart disease is actually going down, but the disease burden in terms of diabetes, overweight, inactivity, those kinds of things is actually going up. So we hope that those statistics continue, but we don't want to see them change. Next slide. So mirroring a little bit of what Liz had to say, congenital heart disease occurs in 1%. 25% of the kids present in the first year of life, and they have to be dealt with or treated in that first year. So that means about 40,000 children are born with heart disease every year. The plain and simple fact is it's not well tracked into adulthood. So we are curing and saving a lot of kids who have heart disease in that first year. Those kids are growing up to be adults. So at the present time, there's more children who have now become adults with congenital heart disease than there are children with congenital heart disease. Another significant segment of kids with congenital heart disease that could be kind of silent and unknown, especially in the first years of life, is bicuspid aortic valve. It's about 1% to 2% of the general population. It also represents about 1% to 2% of congenital heart disease. 10% of those kids present in childhood, but the remainder don't show up until the 5th and 6th decade. So if we can pick those kids up earlier on screenings, you're actually doing them a favor because those kids are at risk for other cardiovascular problems. As Liz mentioned, out of hospital cardiac arrest is a pretty significant number. And there's a smaller number of folks who have strokes as well. Next slide, please. So risk factors that you may not think about in kids, but they are significant, is smoking. As much as a third of high school students have smoked or smoked, and 12.5% of middle school students. Physical inactivity, basically 26% meet the AHA recommendations of 60 minutes of exercise daily, the rest don't. It's probably more now during the pandemic just because of all the restrictions. The good news is on nutrition, we're making strides, but we're still at about 50 or so percent of kids are actually with improved nutrition. Obviously, overweight and obesity is a problem. Cholesterol and diabetes still a major problem in our young. And there's a significant number of the kids, and these kind of cluster together, cholesterol, diabetes, prediabetes, and hypertension, all present equivalent risks to elevated cholesterol when it comes to cardiovascular disease. And the point is that children, that cardiovascular disease doesn't start when you're 30 or 40. It actually starts when you're about 8 years old. So lots of studies have shown that. Anything we can do in the earliest parts of a child's life is going to be very beneficial as they get older. Next slide. So focusing more on out-of-hospital cardiac arrest, as Liz mentioned, there's 7,000 children younger than 18 years in 2015. 13% of these survived, only 13% survived to hospital discharge. So it's a pretty serious thing that if we can prevent, we're going to make a big difference in those children's and families' lives. And sport-related cardiac arrest comprised about 40% of sudden cardiac arrest in children. Next slide. I think the biggest thing that I wanted to show here was in causes of cardiac arrest, many of them are congenital. So these are things that we're born with. They can be underlying errors of genetic abnormalities, and they sort of focus on several different things. One is the heart muscle itself is abnormal, so it's either too thick or it doesn't squeeze normally. You can have anomalous coronary arteries. So about 24% of the kids who have sudden events while they're playing or exercising have anomalous origins of the coronary arteries, so that as they're exercising, they're developing a heart attack, essentially. And then number 3 on the list is myocarditis, which is going to be more important as we talk about COVID, but it's a significant segment of the kids who have sudden cardiac events. And then finally, of the largest portion of those that list of things that we have there, there's undiagnosed congenital heart disease. So about 2 to 3 per that should be 2 to 3 per 1,000 kids have undiagnosed congenital heart disease that wasn't picked up at birth because they were asymptomatic. And with a lot of kids having spotty healthcare, which is created for a lot of different reasons, but probably magnified by the pandemic, those kids are more likely to slip through the cracks. And so that's where I think screening, especially with VIA and others, is really important. The rest of the list, dilated cardiomyopathy, congenital arrhythmias, they're rare, but they can be detected by screening. Ischemic heart disease, as we talked about, is initiated as early as 8 to 10. And then commotio cordis, which is when you get hit in the chest really hard and your heart stops. And really the only treatment for that is using an AED. So actually having AEDs readily available is very, very key. Next slide. So as Liz talked about, pediatric cardiac screening is pretty simple. There's the initial screening questionnaire, which is something that there's a number of different versions, but the American Heart Association has their own recommendations in it. And that works pretty well in conjunction with a screening electrocardiogram. And we've tried to add screening echocardiograms, which actually helps increase the yield when it comes to detecting undiagnosed congenital heart disease, as well as many of the top tier causes of sudden out-of-hospital cardiac arrest. Next slide. So let's talk a little bit about coronavirus, since we know it's prevalent in the community, and it actually is now being superimposed on our children who have undiagnosed heart disease. When you look at the current figures, most, so 60% of kids who have been diagnosed with coronavirus, either by clinical exam or by testing, have shown symptoms. And that means cough, fever, kind of the usual symptoms that we all know, diarrhea, abdominal pain, those kinds of things. And more than half of them have underlying lung conditions, so that's a predisposing factor. Fewer had neurologic disorders, immune suppression, obesity, and about 5% had cardiovascular disease that was known. 5% of the kids had no symptoms at all. And then 35%, unfortunately, this is from the MMWR, but 35%, it wasn't really known what their symptoms were. So, my guess is they were probably pretty mild, so they might have been in the no symptom category, but we don't know for sure. Next slide. So if you look at just the overall rates, kids do pretty well. Only about 1% are hospitalized. Only about 0.1% make it to the ICU. This is of all children who are diagnosed with COVID disease. And the death rate is exceedingly small. Currently, it's listed at about 0 to 0.25%, so really very low levels. The one thing that's interesting right now, the trend is that there's an increasing amount of COVID-related illness that's being diagnosed, and I think it's because we're doing more testing in children. Before, adults were getting prioritized for the testing because of the concerns regarding their morbidity. And so now I think we're picking up more kids who have it, so that actually, if you look at the most current figures, there's an increase in diagnosis of COVID of about 6%. So it's the one group where the diagnosis is going up rather than down. Next slide. So the complications related to the heart include an inflammation of the heart muscle itself. And actually, a lot of the adults that we have treated have shown signs of myocardial injury as components. Pulmonary shunting of blue blood. In other words, for some reason, the blood, as it's going through the lungs, is skipping the air sacs and actually just going directly to the arterioles. So that's why a lot of times you see people who are very cyanotic. There is also the well-known autoimmune activation and cytokine storm with inflammation, coagulation problems, and then, of course, the delayed onset immune-related multi-organ inflammatory syndrome with delayed fever, abdominal pain, and illness involving two or more organ systems with no other plausible explanation. Next slide. So obviously, in patients who are recovering from myocarditis, we recommend that they do not exercise during the acute phase. People recover from myocarditis a lot of times within a week, and then they can gradually return to normal activities in the space of several weeks. If you had someone with confirmed myocarditis, they really should not exercise or exercise strenuously in competitive activities for 3 to 6 months. I've listed a few red flags, but basically you can lay those out as palpitations, positional chest pain, and an unexplained chest change in exercise tolerance or syncope, which is sort of a general red flag pretty much for any child. Return to play testing can be performed by a cardiologist, so that's probably a good idea in most athletes. If they've had any degree of illness with COVID, they should have a minimum of an EKG, an echocardiogram, troponin levels, and if necessary, a cardiac MRI. The one thing that's unique about athletes is their hearts are different in terms of their cardiac response to exercise. Generally, cardiac chamber sizes get a little bit bigger when you're exercising, so you always have to take that into account when you're evaluating people with COVID, because there are some unique changes that occur with exercise that could make you mistake it for COVID-related injury. Next slide. So I want to conclude by saying that asymptomatic children can indeed have significant congenital and acquired cardiovascular disease. And this can be everything from arrhythmias, heart muscle problems, and structural problems. Sudden cardiac arrest in children is caused mainly by known entities, thickened hearts, that it's inherited cardiac artery anomalies, some of which we can detect by testing, heart muscle inflammation, and other arrhythmias. And in patients who've had COVID-19 in our patient group, so in other words, in children and young adults, the concern is that these patients have heart muscle problems that may go on to become arrhythmias, heart failure, and put them at risk for sudden cardiac arrest. So in other words, again, as you remember back to that other slide, 20% of the kids who die suddenly have myocarditis. And the thing we don't know with COVID-19 in patients who are minimally symptomatic or without symptoms at all, how many of those actually have significant amounts of inflammation in their hearts and should be monitored more closely or even prevented from returning to play. So hence, I think it's really important that those kids get looked at closely and evaluated. You know, at least the early studies have shown that maybe as much as 40% of kids have this sort of asymptomatic myocarditis. So it's really kind of key that those folks get evaluated before returning to play. And I think the screening testing has also got to take that into account. So that's, I know I covered a lot in a short period of time, and hopefully that's been helpful.
Thank you so much, Dr. Griffin. Yes, that was a lot of information. We've got to absorb that. So anybody who has a question, please feel free to type it into the chat box. We still have enough time to be taking some questions from you, the audience. Right now, though, we've heard a couple of important acronyms, SCA and AED. Liz, can you take us through what those two mean?
Yeah, absolutely. So sudden cardiac arrest, SCA, is a little bit different from a heart attack. A heart attack can lead to sudden cardiac arrest, but a heart attack, how I always explain it, which I find the most helpful way, is a heart attack is kind of like a plumbing problem in the heart. If you imagine your body as a house, the upstairs toilet's clogged, that's kind of a heart attack. Whereas if you're flipping the breaker on and off and everything's going haywire, that's cardiac arrest. So cardiac arrest is like an electrical problem in the heart, where it's not beating normally. It just goes into like a crazy sort of rhythm. And what happens is it's not pumping blood, right? So it's not pumping blood to the brain. And the first sign of cardiac arrest is just passing out. Like you pass out. And after 4 to 6 minutes without oxygen to the brain, you experience brain death starting. And after 10 minutes, your chances of survival are pretty much 0. So chances of survival go down 10% for every minute you go without getting the getting your heart restarted and without getting oxygen to the brain. So when we think about somebody having cardiac arrest, they just pass out, and you have 4 to 6 minutes before, you know, their brain starts to die. And EMS is often, even with the best systems, 6, 7, 8, 9, 12, 15 minutes away, an ambulance with a defibrillator on board. So the only effective treatment for cardiac arrest, that electrical problem, is a shock to the heart called defibrillation. Your heart's in something called ventricular fibrillation, and we want to defibrillate it. And what that does is actually stop the heart. So your heart's in like this crazy rhythm, like a can of worms type thing, not pumping. And the shock that the AED provides stops the heart and allows it to remember how to beat normally. And that's the most simple way I can explain kind of how AEDs work in cardiac arrest. And so what you're looking for is, when we have AEDs available in the community, as we do in Sequoia Healthcare District, we have over 350 AEDs placed in schools and
Liz, just quickly, what does AED stand for?
So an AED stands for Automated External Defibrillator.
Okay.
So you find people that have heart issues and they've had heart attacks or cardiac arrest previously, they have an implanted defibrillator that's below the skin, and this is an external defibrillator. So it's a machine that Erica's going to show you how to use very soon, and that's kind of a cool thing to see. Here you'll get a nice demonstration of how to use it, but it's an external machine. My 8-year-old daughter has been able to use it since she was 3. It's very easy to use, and there's no way to hurt somebody with an AED. And so what an AED does is stop that heart and allow it to regain a normal rhythm. And if you have an AED, your chances of survival go up significantly. So the national survival rate right now of cardiac arrest is less than 10%. So less than 10 out of every 100 people that have cardiac arrest walk out of the hospital, which is a pretty dismal survival rate. But in areas that have strong AED programs, so they have AEDs in schools and police cars and community centers and malls and fields, their survival rate goes up quite a bit. So Rochester, Minnesota is a great example of this. Their survival rate, they have AEDs everywhere in Rochester, is 49% compared with 10% here. So having a strong AED program can really increase that survival rate. The highest survival rate in the US for cardiac arrest is actually in casinos in Las Vegas. So, casinos in Las Vegas, not only are you on camera almost all the time, so they can see if somebody is passing out, but the safety and security teams at the casinos have a competition annually to see who can shock the most people with an AED. And they have a 76% survival rate in casinos in Las Vegas. They want to make sure you're coming back to spend your money.
You can bet on it.
An important thing to know, which I'm sure Erica will talk about, is that you can't hurt someone with an AED. So if you apply it to somebody who's not in cardiac arrest, it won't shock them. There's no way to override it. So that's really important. And that's one of the things why my 3-year-old daughter was able to use an AED. It's literally opening it up, listening to directions and following the directions and putting sticky pads on someone and standing back. So it's super simple to use. There is an app that's available in San Mateo County called Pulse Point. And if you download the Pulse Point app, you can sign up to be notified if there's a emergency where somebody is found unconscious near you within 50 yards or something, and it shows you where the nearest AED is. And so that's kind of a cool app. If you know CPR or hands-only CPR or how to use an AED, you can be alerted to when there's a situation near you. And like I said, there's over 350 AEDs just within the Sequoia Healthcare District in South San Mateo County. And even more in northern San Mateo County. Well, we have like maybe 150 or so in northern San Mateo County. So just by being in San Mateo County alone, and if you utilize this Pulse Point app, you're a step ahead of a lot of people in a lot of areas.
Wow, that's amazing. Amazing. So Erica, you've been waiting very patiently. I know for you, this discussion is personal. So go ahead, do your thing. We are waiting to hear about AEDs.
Well, I first met Liz 6 years ago after I'm actually one of the lucky ones. I have a family member that thankfully survived a sudden cardiac arrest and is one of the 10% that walked out of the hospital after having a cardiac arrest. Unfortunately, my nephew was 17 and a half at the time, but 2 things were going for him that day. One was my mom, who is in the audience tonight, and number 2 is an automated external defibrillator. My mom happened to be a nurse at the time of 55 years. It's now been 60. And she immediately began compressions. My brother-in-law ran and got the EMTs who brought down the gurney, a defibrillator, and he was shocked one time, woke up, looked at my mom and said, "Ow, Grammy, what happened?" And so we didn't have to bury a family member. And now I can't take cardiac arrest away, but my gosh, I can teach people out of it. So I can teach people how to recognize the sign and symptoms, immediately get a hold of 911, start pushing hard and fast in the center of the chest at a rate of 100 compressions a minute. For those of you who survived the disco era, that's the Bee Gees song, Staying Alive. You should see my 30-something-year-old parents to be. They look at me kind of blank, like, what song's that? And then you just keep going and you don't stop until help arrives. The classes that I'm blessed enough to teach, I teach how to just to sustain people. but I teach them proper technique. I teach them all about these wonderful life-saving devices, and I tell people, don't be afraid of them. Turn them on, lift the lever, lift the lid, push the on button. They talk to you. Some of Liz's colleagues that I've been so blessed to work with at one of these heart screenings, not only has my son done the heart screening, but I've also worked them, and I believe in them, and I've watched people have to find out the scary things, but guess what? It's temporary scary for their child to still be here. And that's what I tell everybody to hold on to. And so it's really easy to use one of these. Charlene, would you like me to show on one of the torsos how to use this?
We certainly would.
Okay. All right, give me a second. I want to kind of take the scary out of this for everybody, if you can all see me. So I'm going to take Manny. Manny has had a cardiac arrest, but people in the building saw a sign that looks like this. Sometimes they have a lightning bolt straight through them, but usually if you are in our part of the county or North San Mateo County, you see the sign, and 3 feet below it in a white cabinet is one of these magic doc in a box. So we're gonna have a little listen about what happens here. So let's pretend I'm giving compressions to the mannequin. Someone runs over, lifts up the lid, okay? Lifts up the lid. I'm doing compressions. I've got my elbows stick straight. My hands are right here in the center of the chest, and I listen to it. I take open the package. And remove pads. I remove pads. But where do I put it? Open package. Look, there's magic pictures.
Peel one pad from plastic liner. Peel one pad from plastic liner.
Goes up here on the top.
Peel one pad from plastic liner. Place one pad on bare upper chest. Place one pad on bare upper chest.
And there's the second one right there.
Pad on bare upper chest. Peel second pad and place on bare lower chest as shown.
So now what I'm going to do is just start compressions.
Peel second pad and place on bare lower chest as shown. Do not touch patient. Analyzing rhythm. Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear. Shock will be delivered in 3, 2, 1. Shock delivered. It is now safe to touch the patient. Start CPR. Give 30 compressions. Then give 2 breaths.
So you guys kind of get the idea. So the reason I show the defibrillator with the metronome is I want to try to take the scariness out of it. It gives you something to kind of push to, that tone, to help you keep the rhythm going. Sometimes you'll turn one of these on and it'll tell you no shock advised, continue CPR, because it was looking for something to shock and it just didn't quite find it. And so you continue doing what it tells you to do. It reanalyzes every 2 minutes. You can use them on children, unfortunately not infants, because we can't dial the electricity down. These are meant for people like you and me. My only claim to fame is my mom's a nurse, and that's the only medical background I have. And so if, you know, I can use these. When I was researching them and I met Liz, I had a 3rd grader. I knew they were programmed at a 3rd grade level. It was very relevant to me. And so they're very easy to use. When you're out in public, if you see someone, just grab it. When in doubt, grab it out of the cabinet if it's available to you. If you don't have one and you are in in any area that you think it should be there, find your people and ask them to put them in. It makes the world a much safer place.
So Aunt Erica, what do you say to the teenagers who say, my heart is fine, I don't need a screening?
I tell them you're nuts and go find your mom and let's have a chat. No, you know what? I kind of feel like everybody should be screened, even though, and I think you should be screened often because we don't know. I think that's the biggest thing right now as a parent of 2 teenagers, a 9th and a 12th grader. I'm terrified of them getting this because I don't want the long lasting effects.
Wow. A couple people commented that you can actually buy these. They may have been on sale at one time at Costco. Is that true? Do you think
it is
people should
true?
buy them?
Gosh, now you're going to make me get into this whole debate. I'm kind of a believer, and here's why. When I started a program up where I live, up in North San Mateo County, because of what happened to my nephew, and I went down the path of how do these things work and how do they best work? They best work when they are maintained by a service provider, because you really do have to look at the batteries and the pads. You have to do a monthly check on these things. They're a very, very sophisticated version of a fire extinguisher, if you will. They are sensitive medical grade equipment, and really your best bet is to, if you want to do that maintenance, hey, great, good for you. When I get asked this question in class, I actually follow that up with, if you need a defibrillator in your house, you know, because your doctors told you need one. I'm sure there's a lot of them out there that people purchased, and it was a great intention, and they're probably sitting there with expired batteries and pads that will not stick.
Okay, well, I'll tell you, everybody, you have been amazing. You panelists, we've thrown so much information at everyone tonight. We cannot thank you enough. I think I want to send it back now to Pamela for some final words.
Thank you, Charlene. We just have a couple of minutes. I learned so much. There were times when Dr. Griffin was talking and I thought, oh, I have that, and that, and I'm saying I'm healthy. I think it was a lot of information, and all this is going to be recorded, and our friends at Boys and Girls Club, the youth at Boys and Girls Club, will edit this video, bring it down, make it short and concise. And it's going to be available on our website. So if you want to learn more or hear this again, then it'll probably be ready in a couple weeks. And then Charlene will have it on her Parent Venture forum. She'll send that out when it's available to all participants. I hope you enjoyed tonight. Again, thank you, our panelists and participants. It really is great that you took your time out from your busy schedule and joined us. And it's really good to see you. And Happy Heart Month.
Charlene,
Everybody.
Charlene, I wanted to add, if anybody has any questions that they couldn't ask this evening or didn't want to online, my email address is on the district website, and I'm happy to help you with any questions you might have.
Thank you, Kim. That's a very kind offer. So we're going to say goodbye to all of you who joined us tonight. Panelists, if you could stay on for just a couple of minutes, we will have a quick little debrief again. Thank you, everybody. Thank you to Kim and Dr. Griffin and Erica and Liz and Pamela for all your expertise tonight. We are so grateful.